And I'm letting folks in. Here we go. We have 18 people waiting.
Oh, Doug, is it okay for you? The schedule that we prepared yesterday is okay? Okay.
Yeah, sounds good. Yeah, we'll break in about an hour and a half.
Yeah. And
Okay.
also a question time just before the break.
Okay, sounds good.
Okay.
Well, hello, everyone. Welcome, welcome, welcome. If you're on the East Coast of the US, good morning. And good afternoon if you're if you're east from here, right? What time is it in Italy today?
As a 4-5.
Fantastic. And then if you're on the West Coast, I guess it's really good morning. We're thrilled that you're here. Welcome to the workshop on MBCT for OCD with Fabrizio. We're so thrilled to have you, Fabrizio. My name is Sean Whitty. I'm on the board here at the Institute, and we're thrilled to be able to offer these things. If you're new to us, we're seeking to be a community. We're seeking to be connected and get to know each other's names as we go. So I encourage you to pop into the chat and just say hello, introduce yourself, tell us from where you're zooming in today. And we're thrilled that you're here to further your own practice. And we use that word practice in the broadest sense, both for many of us, if not most of us, a practice that is professional, but a practice that is deeply personal. And we're thrilled that you've come and want to encourage you to offer a donation for this if you haven't yet. It really helps us, keeps the lights on for us. We offer these things on a donation basis for that reason. Thank you for putting the things in the chat. Lori and Sherry, hello, and Linda, Jamie, hello. So I'm thrilled to be here with you. If you have any questions, you can DM me directly. If you have any technical issues, I'll be floating around and I'll hand it over to our board chair, our board president, Doug Baker. Good morning, Doug.
Hey, Sean, thank you. Great to be here. Hello, everyone. How nice that we've got people zooming in from all over the country and probably even some of those other countries that we hear about. Um, but it really is a great pleasure to have Fabrizio Didonna here with us today. I suppose it's fair to say he is the world authority on mindfulness-based cognitive therapy applied to OCD specifically. He has beautifully devoted his life to this endeavor, to this particular treatment focus. He's written a book about it that was published by Guilford Press in 2020. And he teaches this really around the world. He's on faculty in Spain, in China, and he's the founder. I'm just gonna read a little bit of what I've got here. He's an adjunct professor of clinical psychology at the School of Medicine, University of Padova in beautiful northern Italy. He's also the founder and the director of the International MBCT for OCD Center in Vicenza, Italy. And as I said, he's the developer of the therapeutic model and the author of the related manual, Mindfulness-Based Cognitive Therapy for Obsessive-Compulsive Disorder. By the way, that's been translated into Chinese, Spanish, Italian, French, and Russian. Any other languages, Fabrizio, or have any others been added?
Yes, German.
Oh.
And we have here Alexandra, who edited and translated the German version.
Oh, fantastic. Hello, Alexandra.
Hello, nice to meet you.
Oh, wonderful. Thank you for joining us. What a delight.
Thanks for having me.
So Fabrizio, just a little more about him before I turn it over to him. He's also the founder and the honorary president of the Italian Institute for Mindfulness. And he's presented a number of scientific papers and lectures and workshops at conferences, including at Harvard and Oxford. And he's just an all-around lovely human being as I've gotten to know him. Just kind of exudes a kind of a wonderful kindness and good humor and good nature. So I think we are just really so fortunate to have him here with us. Well, that said, Fabrizio, I'm going to turn it over to you, and I'll be monitoring the chat, and we will take time for questions. Maybe I think we'll let Fabrizio present for roughly about an hour, and then before we break in about an hour and a half, we'll take time for questions. So when you have a question, put it in the chat, and we'll do our best to get to them during the question period, and then we'll do the same for the second hour and a half of the presentation today. Okie doke. So Fabrizio, thank you so much. Where do we start?
Oh, thank you so much, Doug. Hi, everyone, and welcome to this workshop. It's a great pleasure and honor for me to be here today and introducing you the therapeutic model I developed over about the last 20 years. First of all, let me thank the Institute for Meditation and Psychotherapy for organizing this event, and in particular Doug Baker for inviting me personally to give this workshop, and also to Sean Whitty for his helpful assistance. So there are several friends and colleagues in this wonderful institute who have the privilege and pleasure to collaborate over the years. For example, Ronald Siegel, Susan Pollack, Chris Germer, Christopher Willard, Paul Fulton, Trudy Goodman, Sarah Lazar. I don't know if they are here today, but I did a wonderful work with them, and so I feel a little bit at home here, and I'm happy for that. So let's get started, and let me share my presentation. Do you see double?
Yes.
Okay.
Got double. Yeah.
Probably now is okay.
There we go. Yes.
Okay. So first, I would like to share with you an outline on the main contents of a presentation and about this model. This is, of course, an introduction to this model because we have just 3 hours, but I hope it will be very helpful and informative for you. First of all, we will try to understand what are the main cognitive processes and biases that activate and maintain OCD problems using basically a mindfulness-based perspective. Then we'll become familiar with the therapeutic effects of mindfulness and compassion practice in changing those OCD mechanisms and biases that we can find in OCD. And furthermore, we'll discuss the rational and cultural and scientific framework of MCT for OCD model. And then we are going to illustrate the key features and clinical perspective of the MCT for OCD model. Of course, we will briefly visit the 11 session MCT for OCD program, exploring in particular its themes and contents session by session. And I hope we also can have some time to show you some preliminary data regarding the effectiveness of this therapeutic program. Now we have some preliminary evidence, but really promising evidence about the effectiveness of this model. And during these 3 hours, we will also have the opportunity to share some unique exercises from the program and also some short videos. One is from a real session. Okay, so let me start with a brief practice. Okay, so we can enter in a mindful mode. And so I invite you to create, to choose a position, a posture that allows you to feel awake and present, a sitting posture. And this is the breathing space, which is an exercise that we can find in the 4th session of the program, and it is an adaptation of the 3-minute breathing space that you can find in the MCT for Depression model by Siegel, Williams, and Tisdale. So we can find very quickly a posture that we can feel stable and that can help us to feel a clear sense of contact with the ground, with the floor. Just keeping our back upright and straight, but not stiff. And once we have chosen a position, a good position, we can decide whether to keep our eyes open or closed, whatever makes us feel more comfortable. And at this point, slowly enter into the first step of this exercise, the awareness phase. So let go of our autopilot mode and focus on the present, the here and now. And then begin to direct your attention to the physical sensations in your body. Try to notice if there is a specific sensation in any part of your body, and direct all your attention there. Just noticing where this feeling is located, where it is most intense, trying to slightly distance yourself from the feeling without judging it. Simply accepting it within your experience. And in the same way, you may bring your attention to the emotion you are feeling right now, in this moment, trying to name the mood you are in right now. You know that there are no right or wrong emotions. Whatever emotion is present, welcome it, listen to it. And now you may bring the same kind of attention to your thoughts. Just trying to observe what thoughts, if any, are going through your mind at this very moment. You may watch them move in front of you as if they were birds flying by or white clouds floating by in the blue sky. Just welcoming each thought as a mere mental fact, harmless, transient, and fleeting. And then, once we have become aware of your physical sensations, emotions, and thoughts, we may enter into the second step, and we may move our attention to our own breathing. Just focusing completely on your breath, noticing the sensations created in you by your breath, such as your abdomen rising and falling as you breathe in and breathe out. And now imagine that your breath is your center, your anchor. Everything revolves around your breath, as if your breath is the sun and your emotions, thoughts, and sensations are planets. No planet can turn off or waken the sunlight that reaches it, just as no thought or feeling can extinguish your breath. Stay deeply focused on your breath. And then you may enter into the third step, expansion. So we may open up the field of our awareness from our breath to include our body as a whole, from the soles of the feet to the crown of the head. We may become aware of our body and our breath together. Breath flowing throughout our body. In each in-breath, we may feel the air flowing freely throughout our body, bringing life and energy. And as we are opening our awareness to our whole mind-body, we are opening to life as it is, preparing ourselves for whatever is to come in our day with a sense of balance, presence, and completeness. Okay. So I think that now we are more grounded in this present, in this here and now. And let me show you the first slide of this presentation, because there is an interesting quote, a quote by Mark Twain that I think you know very well, that is very helpful in understanding the life of people suffering from OCD. When he said, there has been much tragedy in my life, at least half of it actually happened. So the consequences of living in a catastrophic future clearly result in psychological suffering, and in particular in OCD. But I think that obsessive-compulsive disorder is not so far from us, and probably all of us can find the OCD inside of us. Okay, so would you like an example on how can you activate an OCD-like symptom? I hope you all said yes. Okay, because this is an important example of how we can normalize the pathological experience, and extremely pathological experience that normally people affected by OCD have. And normalizing is one of the key elements of the MBCT for OCD program. So if you agree with this test, please take a pen now and a blank sheet of paper. Okay. I try to expand now the view of the participants. Okay, so are you ready? Yeah. Okay. So, and now please write down right now this sentence in capital letters. And then I kindly invite you to write the name of the most beloved, sorry, the most beloved person in your life. If there is more than one, of course, it's not a problem. Okay? Have you done that? Okay. So then I kindly invite you to write down in capital letters the following sentence. So this is a very simple test. I just would like to know, I'm really curious to know what happened now. So could you please let me know how many of you refused to write this sentence? You can also write that in chat. Okay. And it's very interesting because I don't understand why you didn't you didn't write this sentence. I just take a look to the chat.
Yes, I see, Fabrizio, most people said, I can't do it. I can't write that. I refused. It's like an assault. It was impossible to write. I will not write that. Yeah, so very strong reaction, of course.
Yeah, I see. Okay.
And then we've got one person who's responded, I wrote it because writing it is not a threat. It's very interesting, kind of differentiating the words from the actual event, which I suspect it will be a very relevant point in your presentation today. And then the last person, sense of shock that this is the sentence, immediate disconnection from the task. Other people cannot even imagine and could not do it. And then finally someone, I refuse to put that energy into the world. Someone else, shocking to think of it, great example of intrusive thought. And then finally, somebody said, I wrote it only because it would be part of the exercise.
Great. It's very, very, very interesting. How many people were able to write the sentence? So probably.
Yeah, two or three or four, perhaps.
Okay. And let me know honestly who was able to write the sentence but is thinking about cancel, erasing the before the end of the workshop. Can you write that?
So able to write it, but canceling it before the end of the workshop, kind of like erasing it.
Okay. So it is the same. So this is a very interesting example of a typical case of thought action fusion or thought event fusion, which is a typical OCD problem or bias that is normally considered a serious symptom when we see it in OCD. So probably OCD is not so far from us, and it's really interesting because I just asked you to write down a sentence. It is a didactical exercise. But most of you refuse to do that. And probably because the fear, the consequences that you have in mind about writing down a sentence like this. So this is very interesting example of normalization of an obsessive problem. Okay, so there are several examples. Of course, we don't have time today to see all the possible examples of that. But what is also interesting to see is that we very often give into our minds and into what they say to us. So, I mean, thoughts and beliefs in extreme power to a point such that, as it has been said by Robert Oxtel Bolton, a belief is not merely an idea the mind possesses, but it is an idea that possesses the mind. And so human beings are probably the only mammals that is able to be dominated by thoughts instead of using thoughts for what they are helpful for, you know. So as we will see later, one of the key points of the MBCT for OCD program is exactly precisely to help patients remove strength and power from thoughts, so that thoughts can be a tool at our service and not an enemy to fight, you know. This is a really important point. As you already know, probably, one of the main features of OCD is its heterogeneity, you know. And OCD is really a heterogeneous disorder with different attitudes, different beliefs, symptoms, and behaviors. In fact, we can find people affected by OCD with the problem of checking, some other have a problem of cleaning, washing, with the fear of contamination. Other people have a problem of order, symmetry, perfectionism. Some other can have just a pure obsessive. So pure obsessive is a form of OCD without overt compulsions, but with just obsessions or in mental rituals. We can also have people with the problem of hoarding, so the collectors, collectors of objects. And we can also have people with the problem of obsessive-compulsive personality disorders, which is quite different from all the other types. We can also have people with the problem of religious beliefs, strong religious beliefs, of superstition, magical thinking. So we can also have people with a relationship OCD. So people who are which is focused on close or intimate relationships with several doubts and concerns about that. So why is it important to consider this issue? Because if we want to develop a comprehensive therapeutic model for OCD, we are not going to focus on the specific symptoms of the disorder, which are so heterogeneous, so different, but on the common factors of features that people with OCD share. Okay, so that's why I have an important question. I try to answer over the years to an important question. So, what common and transversal factors characterize all types of OCD, and which tools or interventions can be effective in treating each of them? So this is the focus in my experience of the treatment. Focus is not the symptoms, but the common features, the common mechanisms that all types of OCD can share. So in my long experience in treating this kind of disorder with hundreds of patients treated in about 25 years, I found that a general common factors that people affected by OCD share is a dysfunctional relationship with their entire private experience. So sensory perceptions, emotional states, physical sensation, and thoughts. But in particular, they have an extreme difficulty in accepting what? Accepting harmless and potentially useful stimuli or experiences, internal experiences, and the discomfort activated by them. So normally anxiety, disgust, guilt, shame, okay? And furthermore, another common factor is that for them, normally it's very difficult to prevent or delay or give up a reaction toward the specific stimuli that activates the problem. There is a wonderful equation in Buddhist psychology, which is the equation of suffering. The equation of suffering explains in a wonderful way what are the consequences of continuously reacting to discomfort. And also this equation can explain the level of suffering in humans. And the equation says that suffering is the product of pain times resistance. So what does it mean? The more we resist, the more we increase pain, and therefore the more we create suffering. In fact, people with OCD tend to react over and over again in order to get rid of a particular form of harmless pain, which is thoughts, emotions, and sensations. And in this way, they increase pain, which eventually becomes suffering. So OCD is a particular form of suffering because it's a form of pain expanded, okay? So suffering in general is the result of our inability to accept things as they are. And we can find this, of course, in every kind of psychological disorder in general, but in OCD is very, very clear. Okay. So another important, another common factor is what I called an overactivation of the self-protective system in the brain in absence of a real danger. What is the self-protective system? This is a quite popular chart about the affect regulator systems in the brain, because in order to better understand obsessive phenomenology, it is important to know that our brain developed different affect regulator systems, which in some way coordinate attention, thoughts, emotions, and feelings, and actions. So neuroscience has found that there are at least 3 types of basic emotion regulation systems. And the first is the self-protective system of the threat system, which is designed to activate defense mechanisms or safety strategies in the presence of a real or imagined danger, and also specific defensive emotions. Defensive emotions are anxiety, anger, disgust, shame, okay? And also a number of behavioral responses. So, for example, the fight and flight and freeze responses. So it's a very important system, but we also have another system is the drive, the drive or reward system, which stimulates and motivates and drives us toward our goals and our needs. And we know that both drive and protective system are active in OCD because they are, of course, interconnected. And the third system is the soothing system. The soothing system is in some way complementary to the threat system, and it is activated when we perceive a sense of security, a sense of contentment, or a feeling of trust, or we feel a satisfied need, okay? And these systems are in constant states of co-regulation and interaction. But when we are threatened, the other 2 systems are switch off. And when we are not threatened, and the soothing system is satisfied, we can pay attention to our life goals and activate also the drive systems. So why it is important to know? Because of course we can see in most of the psychological disorders, but in OCD is very clear that the protective system is overactivated. Is like an alarm in constant activation in absence of danger, of course. In fact, also from a neurobiological point of view, we see that in the brain, the networks that send out warnings are too active, and also the spontaneous reactions to these warnings are too strong, too intense, and too frequent. And the systems that are supposed to inhibit them, so the soothing system is too vague. Okay, so how we can rebalance in a healthy way all of these systems? I think that you can guess, you can imagine what could be the answer, but I will explain that later with the next part of this workshop. And this is a very scary image that probably many people with checking OCD have in their mind when they think they have forgotten to lock the door. So this seems quite funny, but not for OCD people, as you can understand. So the fourth common factor I found that I found is transversal to all kinds of OCD is a feeling, a general feeling, a dysfunctional feeling of self-mistrust. This is an important part of in the program and in this model, because we can see very easily that in general, in people affected by OCD, we can find a cognitive distrust, in particular toward their own private experience, their internal experience, and also toward some basic functions of consciousness. The first of them is perception. Okay, so OCD people always have their senses up and running, but they are not able to validate what their senses are communicating to them about critical situations. So the mind takes over. Another point is distrust in memory. OCD people normally have a good memory, very often even better than ours, but they just don't trust their memories. So they are never sure about what they did or did not do. And the third element, element of distrust in OCD is about intentions. Okay, this is not it's not true for all the people affected by OCD, but in particular for people with the problem of checking, you know. And this is really a paradoxical issue because these people fear doing something that is always the opposite of their real intentions. And that's why they never do what they fear doing. We can be sure of that, of course. So they can fear to be, for example, rapists or pedophiles or killers. So something that they will totally hate to be. Okay. So this is also another important topic in the program. So help people to validate their real intentions. So they need to start from intentions if they want to develop trust. So OCD individuals distrust all the functions that normally give us the best possible relationship with reality. And that's why I conceptualize OCD as a trust disorder. Okay, and the work about trust is an important part of the MCT for OCD model. there is a wonderful quote by Frank Crane, an American writer and journalist, which summarizes the problem of trust in OCD when he says, you may be deceived if you trust too much, but you will live in torment if you don't trust enough. Okay, and actually this is the life of OCD individuals. Okay, and so let me show you some information and data about what is effective for OCD. We know, of course, that CBT is considered now the gold standard in the treatment of OCD. In particular, when we use exposure and response prevention, we know that it is the most effective therapeutic intervention for OCD, with an important rate of improvement for people who accept this kind of treatment. We also know that pharmacotherapy is an effective treatment for OCD, in particular when we use serotonergic antidepressants, and we can have a 40 to 60% response rate. But there is a but, because we have some limits in these already established treatments, and because we know that an important number of patients with OCD do not respond well to these established treatments, and also they don't respond to the antidepressant medication treatments. And in the longer term, we know that pharmacotherapy is associated with a high relapse rate when the patients stop taking their medicine. You know, about 80–90% relapse in this case. And furthermore, we know that many people who enter ERP therapy tend to drop out before the end of the treatment because of the highly anxiety-evoking nature of the treatment. We also know that ERP and CBT is not very effective with individuals suffering from obsessive or ruminative thoughts, but without over-compulsions, and in patients with overvalued ideas, so with a very low insight. Okay, so CBT is very effective, but is not effective for everybody. And in this chart, we can see some interesting data from some well-known CBT authors, in which there is the state of the art of the outcome of CBT for OCD. So we know that about 20% of patients who are administered CBT failed the treatment and or relapsed at follow-up after 6 months or till 5 years. And we also know that about 25% of patients refuse the treatment after its explanation. So when you say, okay, you have to stay with your anxiety, and your anxiety will grow up at the maximum level. Very often patients say to you, okay, thank you very much, doctor. I will call you later, okay? So normally this is what can happen. And also 12% drop out when they decide to start with this kind of treatment. And so we know that at the end, less than 50% of patients improved with the CBT. So there is my friend here with the doubtful expression, and so what can we realistically do to help people with OCD who have yet to find enough relief from OCD? And what therapeutic means, techniques, principles, approaches, and tools do we still need to include in the already established treatment to improve and strengthen the effective therapeutic approaches? What we can do? This is a question that I tried to answer for many years, and probably you can guess what could be the answer. Okay. The answer is mindfulness. So mindfulness can be the key. Actually, mindfulness and compassion. And I will try to explain why. And we can start just from the very popular definition of mindfulness by John Kabat-Zinn. And from that, we can easily realize how the state of mindfulness is different, or is even the opposite of OCD states of mind. So the mindfulness is defined as the awareness that emerges through paying attention on purpose. Okay, so OCD people have attentional deficit, so for them it's very difficult to pay attention mindfully using the senses, for example, to anxiety evoking stimuli, and to pay attention to what is not connected to their problem, and could potentially disconfirm and overcome their fears. The second element is in the present moment. So for OCD, they are almost always in the past. So when they ask to themselves what they could have done, for example, or their mind is in the future. What could happen if I cannot prevent? Okay, so it is quite different. And the third component of this definition is non-judgmentally. People with OCD constantly judge themselves for their behavior, for what they feel, for what they think. Okay, they are in a constant judgment. Okay, toward their internal and external experience. So we can see by definition that OCD can be seen as probably the opposite condition of mindfulness. In fact, OCD can be defined as a state of severe mindlessness, which is the opposite of mindfulness. So a training in mindfulness can be very powerful, just starting from the definition. But my group of research, my research group tried to investigate this issue, and we tried to understand if these mindfulness deficits we hypothesize in OCD are actually present in this kind of disorder. And in this paper, in this research we published in 2018, we investigated a sample of 50 patients with major depression, a sample of 50 patients affected by borderline personality disorders, 50 patients with OCD, compared with a sample of non-clinical people. And what we discovered is very interesting, because we have seen that all three clinical samples showed the significant deficits in mindfulness. You know, you see here these three clinical samples have significant deficits in mindfulness measured with the FFMQ scales by Rothbard, compared to normal sample. And this is very interesting, because this outcome supports the rationale of using mindfulness, or a mindfulness-based approach integrated with the CBT with this kind of disorder. Because if we are able to demonstrate that in the post-treatment there is a correlation between a clinical improvement in OCD and in mindfulness skills, we can hypothesize that probably mindfulness can be the mediator of change. Okay. And if you are interested in this paper, I can send you after the workshop. Okay. So there is a brilliant quote from the Anguttara Nikaya, an ancient Buddhist text, that sums up, in my opinion, the effective treatment of OCD. When it says, not through actions, not through words, do we become free from mental contamination, but seeing and acknowledging them over and over. So this is pretty interesting, in my opinion, because translating in OCD terms, we can say that not through rituals, not through reassurances or verbal compulsions, do we become free from obsessions, but just observing those thoughts at a distance and without reaction. And this is exactly what we do when we practice mindfulness meditation. So in this quote, in my opinion, we can find the essence of effective treatment for OCD. Okay. There is a very popular, but also fascinating video that explains very well the essence of acceptance, but also the centering that we also share with our patients during the MCT for OCD program. And this video is the fly, you know, and I would like to I would like to show you. Sorry. Maybe. Oh, let me know, please, Doug, if you can hear the sounds and everything is okay.
Okay, I'll let you know. All good.
Can you hear the sounds?
We are hearing the sound, Fabrizio.
Okay, I can't. Okay, so I think it's very, very clear, the message, without words. Okay, so mindfulness training, and in particular, MBCT for OCD has been designed as a comprehensive approach for the individual affected by OCD. So it is focused on the person as a whole and not only on the specific symptoms of the disorder. So treat the patient as a whole person. This is an important issue to consider when we use this kind of program. So it can be defined as a whole person care model, okay? And also, through mindfulness training, we realized some basic and quite simple healing principles regarding internal states as we develop a new relationship with them. Okay. The first is that thoughts arise unbidden, so spontaneously, without invitation in our mind, and they are mostly involuntarily in our minds. So we don't have to try to prevent or control unwanted thoughts, as it is impossible. This is important to bear in mind, also in our relationships with the thoughts. A second point is important point is that we are not our thoughts, and we are also not our emotions and sensations. So we can develop a disidentification from our internal states. I'd like to say that we are the context in which these states happen, that come and go, and not the states themselves. This is an important distinction that we have to do. So, for example, thoughts are not ours in themselves, because they just happen. They come up in a certain moment and then disappear. Okay? So they are not ours simply because they occur in us. Okay? It is like when we hear sounds, we don't think we are those sounds just because we heard them, right? Okay? So we should have the same attitude toward thoughts. And another important point is that internal states are by nature harmless and potentially helpful, even though sometimes they can be unpleasant. Okay? But this is an important point that I think that all therapists have to bear in mind when we have to work with the patient, and when the patient have a problematic relationship with their internal experience. Another key point is that we can learn to stand back from our thoughts and just observe them without reacting to them. And when we do that, we can modify our relationship toward our internal experience, and in this way we can relieve suffering. Okay? Would you like to see some real example of patients who were able to overcome and they dramatically changed their relationship with their threatening contents? Would you like to see that? Okay.
Fabrizio, I'm just wondering, pardon me for one moment here. I see it's we're about an hour and 20 minutes into the presentation, and I wondered if we want to pause for a few questions and then take a break.
Yes.
Or what do you think?
Yes, I just want to show you the pictures of some patients, and then we can have 10 minutes for questions, and then we can have a break.
Sounds good.
Okay. Are you curious to see the patients? Okay. So the first patient is the white one, who were able to overcome perfectly his worst fear in his life. okay, after mindfulness training, of course. And another patient is the white and black one, you know, who was able to overcome as well his worst fear. And what is interesting to see is that when we add compassion, when we include compassion in the training, we can see this effect. Okay, so it is extraordinary. No? Do you agree? But we can also see another important effect. If you, with more mindfulness training, okay, we could also reverse the relationship with the threatening contents in this way. Okay, so extraordinary effects, extraordinary outcome. Okay, this is the power of mindfulness and compassion. Okay. Okay, this is a joke, of course, but we can have now about 10 minutes. If you have some comments or questions, you can also write down in the chat.
So I'll pause here for a moment and just invite questions. You can also raise your hand if you want to literally raise your hand if you would like to ask a question. Okay, Jamie, yes, please. Can we hear from you?
Hi there. This is great. Thank you so much for offering this. So I am a MBCT facilitator for anxiety and depression, and I really enjoyed your responsive breathing space offering. And I was just noticing what seemed like a lot of differences in how I was trained to offer it. So the use of analogies and being really intentional about the qualities we're trying to cultivate. And I'm just curious, like, was that intentional in terms of treating OCD?
Yes. What is the effect with OCD? Yeah. Yes, this is a. I tried in particular to modify the second part of this exercise in terms of focusing, in terms of centering, and I also use the metaphor of the sun and the planets that many patients found very helpful in order to feel more centered and to feel that the breath is the center, not thoughts, emotions, and sensations. And many people told me that it's very helpful, this image and this metaphor, this sense. And thank you for sharing your feedback on the exercise. Any other questions?
Did you get an answer, Jamie? Did Fabrizio speak to it? Okay, terrific. Just want to double check. Thank you for that. I too noticed there was I'd never quite heard the practice led in exactly that way that you did, Fabrizio. There were elements to it that I won't repeat, but yeah, I had a similar experience and kind of question as Jamie. There's another question that just came in the chat that I'll read. So have you found that introducing mindfulness practices in a group setting makes it easier for people with OCD to practice the skills versus kind of a one-to-one teaching of meditation and mindfulness?
Oh, yes. I will talk about that later at the end, but toward the end of the workshop. But when I developed this program, I tried to create the possibility to provide the program in a group, but also in an individual setting. And this is important because we know that it's not so easy to create a group of people affected by OCD for several reasons. And what I found is that there are not significant differences in using the program in group or in individual. There are different settings, but we can have some advantages in the group and advantages in the individual setting, and as well as we can have some disadvantages in group and disadvantages in individual. But in general, the outcome is almost the same. Okay, we just have to consider some particular differences between these two when we provide the program.
Thank you. Fabrizio, I'll ask a question. It was terrific to hear you talking about the response prevention treatment and the combination of that with the antidepressant. And now we're adding in this kind of third component of the mindfulness. Do you know of research or do you have experience with folks who are, if they're not on antidepressant, can they still kind of make good use of mindfulness skills? Has that been kind of teased apart?
Yeah, I will show you. I will show you at the end of the workshop this part about research because it's very interesting.
Okay.
As you probably already know, I tried to create an integration in this program between ERP and mindfulness, what I called a mindful exposure, because I realized that for many patients are difficult to sustain the level of anxiety that normally they have with the standard behavioral ERP. And I created also a different rationale with ERP because the aim in mindful exposure is not to expose to anxiety and waiting for his reduction, its reduction, but is to enter into the challenging situations or stimuli in contact with the reality as it is. So mindfulness can help to be in touch with reality. So in the way in which we could see that stimuli this situation, so in a normal way, okay. So the aim is to expose to reality as it is, not to expose to anxiety. This is an important difference.
Yes. Okay. We've got two other questions. One, I wonder if you can speak to this. This is about trauma. Can you explain briefly, this might be hard to do, how trauma actually impacts the brain and leads to OCD? Is there, I guess I'm reading into this question, is there a linkage in your experience with trauma and OCD and the impacts in the brain?
Yeah, we know that many people affected by OCD have an experience of traumatic events in their life. The rate is controversial. Some statistics say that about 60 or 70% of patients can have traumatic experiences. Others are lower than this. But normally, in my experience and in my understanding of OCD, is that very often traumatic experiences are a trigger of a predisposition that they already have to develop OCD. So is not so much the cause of OCD, but they are triggering stimuli that can activate in certain moments, normally during adolescence or the young adults, they can activate the problem. In a few cases, we can see that OCD has been caused by really traumatic experiences, such as rape or violence, several experiences of violence. But it's not so common that, in my experience.
Thank you. Well, we've got 11:30 here, 5:30 your time. Shall we take a break now? There are a couple of other questions. Should we hold questions till later and we'll take a pause now? How are you feeling, Fabrizio?
Yeah, for me it's okay. How much we can have? 15 minutes is okay?
That sounds good. Yeah.
Okay. So
Okay. Well, I'll just say I'm just so delighted. This has been so clear and very thoughtful, and your experience that you're sharing with us is just, wow, so rich and so appreciated. So we're only halfway through, and I just want to thank you so much. So um, so we'll take a 15-minute break, folks, and we'll gather again 11:45 East Coast time, and see you in 15 minutes.
see you soon.
Okay, welcome back, everybody, or come on back wherever you have wandered off to. Fabrizio, I hope you got a little rest for your vocal cords there. We're giving you a real workout this morning, so hope it's workable for you to continue. Great. Fabrizio, one quick question. Couple people have asked if it might be possible to have your slide presentation. You've been very generous with us with your time and allowing us to record this. So if there's a way that that could be done, it would be, I think, most welcome.
Yes, of course. I will be glad to send to EMP the handouts of this presentation and also some other material that can be helpful for you to deepen and better understand the model. So some articles, and also I have a sum up of the MCT for OCD model. And maybe if you like also the scripts of the breathing space, or if you have the chance to share other exercise, I would be glad to share.
That's incredibly generous of you. Thank you. And I know at least a few people, and I imagine almost everyone would be interested in the breathing space script. That would be incredible. Now, I'm imagining much of this is in your book as well. Is that right?
Yeah.
Okay, so let's just put in a plug again for the book, again, published by Guilford Press. If you search for it with Fabrizio's name and the subject, you will find it. I wonder if I can ask you one clinical question, and then I'm going to turn it back over to you. Is that okay? Can we start off with one question?
Okay, if you like.
Okay, great. I myself was curious about if you could say just a little more about the whole person treatment that you were referring to.
Yeah.
What does that mean for you?
Yeah, that means that when we use mindfulness and compassion, we are aiming to create the best connection, the best integration between mind and body. Okay, it's not just the problem of how to treat the specific symptoms of the problem, because it will be ineffective. We know that. But is to how to help people to change their modes of mind and their cognitive mechanisms that tend to activate specific obsessive reactions. That's why we know that this program is effective not only for OCD or for OCD symptoms, but also for example, for depressive symptoms, for anxiety symptoms, for general pathology symptoms. And this is interesting because that means that these practices, mindfulness and compassion, intervene transversally through the different form of suffering that person can have. And this is also important because we know that in OCD there is very often some important comorbidity. So OCD is very often associated with depression, for example, with anxiety disorders, with personality disorders. And what we have seen is that we see the same improvement in patients regardless the comorbidity that they have.
Wonderful. Thank you. So encouraging. Yeah, you're connecting it all as suffering, right? And there's so
Yeah,
many forms of suffering, of course, and OCD just being one form. Yeah.
yeah,
Okay.
that's right. We want to treat the different form of suffering, not specifically the symptoms of OCD.
Yeah. And we know that I think we understand, we practitioners and researchers understand that the suffering is not just a cognitive experience. It is a whole person experience, right? It's
Definitely.
emotional, it's cognitive, it's behavioral, it's in the body. Yeah.
Definitely. In fact, through um, the compassion part of the program, we work mostly toward the emotional part of the person, not toward the cognitive part. So this is an important integration. Um, for example, cognitive behavioral therapy works in particular toward cognitions, of course, behaviors, and through mindfulness and compassion integrated, we integrate these two important systems, so cognitions and emotions. And this is important with respect to the general outcome.
Thanks again. Okay, I'll turn it over to you and
Okay, so I can share again the slides. There are also some important questions in the chat, but I hope to be able to answer maybe at the end of the workshop. And actually, I'm also curious to know where do you come from? I don't want that everyone say that now, but if you want to write that in the chat, I will be curious to see that later. I'm from Padova. Padova is a nice town, nice city in Italy, northeast of Italy, very close to Venezia. Venice, you say Venice, but it's Venezia. Venezia and Verona. Okay, so, and now I'm here in Vicenza. Okay. You see the double screen, real. Yeah.
right.
Now just one.
That's right.
Okay. Okay, here there are our friends. So, to sum up, why MCT for OCD can be helpful, effective for OCD. We understand that OCD individuals need to learn effective ways to permanently overcome from their cognitive biases, as we have seen before. And for example, we know that mindfulness is a state of mind in which individuals pay attention in a particular way, by definition, to the present moment, on purpose, and without judgment. And this is actually the opposite of rumination. So we know that mindfulness training is affected with rumination, and it is also an effective anti-avoidant attitude. And the first component of mindfulness is self-regulation of attention, so that it is focused on the immediate experience, and so through mindfulness we can help people to overcome the mindfulness deficit that we can often see in OCD. Furthermore, through mindfulness, a patient can develop some extremely important skills such as decentering, diffusion, disidentification. So they start to think that, for example, the patient realizes this feeling is not me, this thought is not me, this sensation is not me. Okay, I feel the sensation, but I'm not this sensation. So they are able to observe their internal experience as a neutral witness. Okay. So we know the mindfulness training leads to a shift in perspective. No? Furthermore, through mindfulness training, patients are able to decrease the overactivation of the self-protective system and to increase a more stable activation of the soothing system in absence of real danger, of course. And not only mindfulness, but also compassion can create this kind of effect by a number of researchers. And also, mindfulness can help people to develop a strong feeling and attitude of acceptance that we have seen that how it is important for OCD, and also an important validation of internal states, in particular, the validation of their senses, as we will see also later, more in particular. We introduce self-compassion in the ninth session of the program, because it is very powerful to normalize what is the pathological feeling of guilt and responsibility, the inflated sense of responsibility that most people affected by OCD have. And furthermore, last but not least, mindfulness and compassion are aimed to help people to develop a feeling of real self-trust. This is probably the most important component of the program. So let me show you the rationale. Let me explain and discuss with you the rationale and what are the distinctive features of the MCT for OCD program. We have to say that MCT for OCD is developed through an integration between four main scientific and cultural areas. The first is evolutionary psychology. In fact, several studies show how obsessive symptoms are basically normal, and adaptive defensive responses to threatening stimuli and situations. And in this sense, they are not the real problem in OCD, but we can say a logical consequence of a threatening way to interpret reality. So evolutionary psychology can help us and our patients as well to make it possible to normalize psychological problems in a way that is logical and consistent and coherent, you know. And so it's very helpful to develop normalization, which is one of the key elements in the MCT for OCD program. Another important area is neurobiology. In fact, this is important in order to understand how the mind can change the brain. So the phenomena of neuroplasticity. We know by research that in OCD, some specific areas in the cortex are underactivated or overactivated. In particular, the prefrontal cortex, the medial prefrontal cortex, and the anterior cingulate cortex are underactivated, and some areas in the limbic system, such as amygdala, are overactivated. What is really interesting to see through the research in the neurobiological research with the mindfulness, about the mindfulness effects, is that mindfulness training can create an opposite effects in the brain. So can stabilize and activate in a normal way the same area in the prefrontal cortex and underactivate the area in the limbic system and the amygdala. So mindfulness acts in an opposite direction of OCD mechanisms, and this can create a rewiring in the brain through mindfulness training. And there is a very interesting quote in Buddhist psychology that says, what you practice grows stronger. That summarizes what I'm explaining now. We know that repeated mind habits can create specific circuits in the brain. OCD, dysfunctional mental habits, over the years, we know that in OCD, the problems are developed over many years. And these dysfunctional mental habits can create specific neuro circuits, particularly as I showed you in the prefrontal cortex. But if we help people train their mind in healthy and functional ways, we can rewire OCD circuits by creating new healthy and functional and stable circuits in the brain that will be, of course, associated with a more functional way to relate to internal and external experience. And this is a pivotal point in the model. So help people to train the mind in order to change the brain. And how we try to do that, how we can help people to train the mind to change the brain in a functional way. We try to do that in several ways. For example, basically through mindfulness training, an intensive mindfulness training, introducing new healthy habits in the life of people affected by OCD, through cognitive training. Of course, this is a mindfulness-based cognitive training, so there are some important parts of cognitive intervention. Through the mindful exposure, this, as I told you before, an integration between the ERP and mindfulness in order to help people to expose to challenging situations and stimuli, through self-compassion training, helping people to take mindful risks. This has done in the end of the program in order to help people to not only to recover from the OCD symptoms, but also to live the life that they want to live. So an enjoyable life. And they need to take a risk. And taking risks is the more powerful way to also to develop a self-trust. So this is an important part toward the end of the program. And furthermore, we help patients to be more aware of their real intentions, but also to create and to cultivate healthy intentions in their life. There is a particular homework that we give in the 8th session of the program. It is related to this issue. Develop and cultivate healthy intentions in their life. So the third component is, of course, a cognitive behavioral therapy that help people to be more aware of the cognitions that activate and maintain the problem, but also to develop a different attitude, a different relationship to thoughts. And last but not least, the Buddhist psychology that inspired so many components, principles, and tools of this program, as we can easily understand. So, what are the basic features of the MBCT for OCD program? We planned and implemented a specific 11-session MBCT format for OCD, in which we try to cover the most important topics for OCD and train participants to overcome their specific deficits. Differently from other mindfulness-based models, MBCT for OCD has been created to provide not only in group format, in group session, but also in individual one-to-one session. This is important because, as you can understand, it's not often easy to create OCD groups. And we also know that some people, not so many actually, but some people affected by OCD can have difficulties with group participation, with stay in group, stay in contact with other people. So we can provide the program in person and in a virtual online mode format. And this is particularly important because this allowed our center to provide the program to many people, also not only far from the center, but sorry, what's happened? Okay, far from the center, but also abroad in other countries. So, and we found that the outcome is not so different from the format in person compared with the format online. The number of sessions is 11 sessions. We have what's happened? I don't understand. Okay. We have 11 sessions. We have 9 standard sessions of 3 hours. And also one session with the family members and partners. And the final session is a one-day retreat. It is a final, really motivational session. I think it is now activated. Okay. The duration of the session is a 3 hour in the group format and 2 hour in individual setting. And we also invite patients to practice for at least 1 hour a day, 7 days a week. And in each session, we have several static meditation, static practices, but also from, in particular, starting from the fourth session, also dynamic in movement practices. So we try to integrate practices that are more static with practice that involve the body. Okay. A number of participants, normally ranging from 4 to 10 people. It's important to have a group not large group like in MBSR, for example, because they are patients in an acute phase, and we need to give the right space for each of them in the group. Okay, so I mentioned before what are some of the key features of MBCT for OCD program. The first feature, important features in this program, is understanding. So where we help people, in particular in the first sessions of the program, we help patients understand the scope and goals we want to reach with this program. So in particular, understanding what mindfulness is, how OCD works, and how mindfulness can be helpful for these disorders. We say we say to patients, understanding is the first step to healing. Okay, so we try to help patients in this. The second key feature is normalizing. Normalizing means helping participants understand that their symptoms are not so pathological, and they are not as crazy as they think, and why their symptoms are potentially adaptive and functionally defensive behaviors toward perceived threatening stimuli. So normalizing is what is very often the opposite of what they are used to hear very often from some therapists that say to them that they have a chronic disorder, intreatable disorder, and they have to stay with that disorder all life long. This is not true. We have to reverse this attitude and help people to understand that they can overcome the problem, but that they need to commit themselves in an intensive training. Okay. The third key feature is helping people to develop self-trust and self-validation toward their internal experience. So, I mean, thoughts, emotions, physical sensations. And we dedicate 2 sessions of the program to these topics, this issue. Of course, another key feature is an intensive training in mindfulness and compassion in order to help people to change to train the mind to change the brain, as I told you before. There is also, of course, an important cognitive intervention in the program. Mindful exposure is also another important key point, key feature, and we encounter it in the 8th session of the program. And in group setting, in the group format, sharing is also, we found that sharing is also an important therapeutic element because very often these patients meet for the very first time other people who have the same problem, and they can share, they can discuss with them about any topics, any issues about the problem, and also can have can travel together in this journey, in this therapeutic journey, and this can have a therapeutic effect. Okay, let me show you very quickly what are the session themes of this program. We have 45 minutes. The first session is focused on understanding what mindfulness is. So we have some basic exercise, some basic mindfulness practices, such as a body scan, raising exercise. It's not so different from the first session of MBSR and MBCT for depression, because those sessions are perfect to help people to understand what mindfulness is. So an introductory session. The second session is focused to help people to understand how OCD works, and then how mindfulness can be helpful for OCD, and to change most of the cognitive biases and mechanisms that activate and maintain OCD. The third session, as I told you before, is organized with family members and partners in order to help them to be more helpful with patients affected by OCD, because we know that we know that very often family members activate some actions, some behaviors, some roadblocks, I can say that can be very counterproductive for the treatment, for the program. So we inform family members what is helpful to do and what is not helpful to do if they want to help, give a good help to their family member. And so we can also have very often a co-therapist in the program in this way. The fourth session is dedicated to helping participants better understand the possible origin of their mistrust, and starting to develop a real self-trust. And we also share several things that they can do every day in order to develop self-trust. The fifth session is dedicated to trust as well, but we start by using the senses to develop trust. So we help people to understand that trust starts by our senses, to validate our senses, to believe to what our senses is saying to us continuously, and not believing in what our mind says to us. The sixth session is particularly important because is aimed to help people to develop a healthy relationship with thoughts, So we share with patients a clear understanding of the real nature of the mind, the real nature of thoughts, and in order to help them to decrease the power that they tend to give continuously to thoughts, to internal states, and to all the product of the mind. Okay. The seventh session is a focus on acceptance. So we say developing acceptance is the core step to change. You can't change what is you are not able to accept. Okay, so they need to understand the true meaning of acceptance and understand this powerful attitude. The eighth session is focused on mindful doing, mindful intentions, as I told you before, and mindful exposure. And but you need to understand that exposure is an attitude that patients start to develop from the first session of the program, not now, not at the eighth session, but they develop exposure in a gradual way. And in the ninth session of the program, we introduce self-compassion and self-forgiveness, which are some core skills in order to deal with pathological guilt, the inflated sense of responsibility that we very often find in this kind of problems. And the 10th session is aimed to help people to take mindful risks in their life. So to expose to life, not to expose only to the challenging OCD symptoms, but to expose to life, because very often patients affected by OCD live in a very close life. They are close in their house. They give up to have a job. They give up to continue study. They give up relationships. So if they want to have a general and a global relief and global improvement, they need to expose to life. So this is an important issue that is discussed in this session. Finally, the last session is titled "Facing Life with Trust and Dealing with Obstacles Effectively." It is a 1 day of sort of mini retreat, a short retreat in which we revisit some of the practices of the program, and we discuss about how each practice has been helpful for them, and we discuss about what has changed in their life, and what are their improvements, but also what are the things that they need to still improve. But basically, we try to motivate patients to keep on going with the practice after the end of the program, because this is a crucial point. They need to go on with the practice if they want to maintain the outcome, to maintain the improvements. And the patient that we have in our program, in our program, who are totally recovered from OCD, and we have many patients of this, witness that they kept on going with the practice over the years. So they included the practice in their life as a normal, healthy habit, not as a therapeutic tool. Okay, and this is an important difference. So This is a short video with real patients, not animals, in which you can see one important exercise from the fifth session. The fifth session is, as you remember, dedicated to validate the senses. And this exercise is called a mindful perception, in which I invite patients to pay attention to an object in that environment and pay attention using just one sense. First is the sight, then they use the touching, and then hearing. Okay, and they are invited to validate the information that comes from those senses. Okay, this is an important part in order to learn this important skill. Okay, let me know if you can hear the sound. I can't hear the sound, but it's important that you can hear it. So the first part is seeing. So looking at the object and just notice what you see in the object. So particular features of the object, shape, colors, and not labeling the object. Okay, but just noticing and describe mentally features, the physical features of the object. This is a wonderful environment where I conducted groups for many years. And this is the touching phase. Just noticing what the touching communicate to you in terms of consistency, shapes, and everything that you can feel by touching the object. And now they are going to pass to the hearing experience, the mindful hearing experience, perception. Okay. So this is an example of what happened during a real MBCT for OCD session. And we also have some very important discussion in each session, but in particular in the sixth session, we have a discussion about what is a thought. And because thought is, of course, probably the cause of all the human problems in several ways. But we help patients to understand that the real nature of a thought, so from as a phenomena, is that they are all electrochemical reactions. A thought is an electric micro impulse or signal in the brain, or we can say that it is a little spark or wisp of energy in the brain. of course, it is a synapse, so a connection with your neurons. But this is what actually a thought is. And this is a very, very liberatory realization when they are able to understand this. We also say to patients that among the different features that thoughts have, in particular, they have 3 features that begin with the I, okay? Because thoughts are always insubstantial, they are inconsistent, they're intangible, okay? All thoughts are innocuous, harmless, totally harmless, and they're also impermanent. So you just have to wait for some seconds, okay? And then if you don't do nothing, all thoughts disappear if you don't react to thoughts. And this is also a very helpful realization for patients if they are able to bear in mind these 3 features, okay? But we also help people to understand what are emotions. And because this is another one of the worst enemy for humans, and it is incredible because emotion is one of the most potentially most helpful internal experience that we can have. And we know also that all emotions have specific functions that are in some way adaptive and potentially useful for our life. But if you are not able to understand that, you can transform emotions in enemies, okay? But an emotion, if you look at an emotion from a phenomenon point of view, you can see that an emotion is just a particular combination of thoughts and physical sensations, okay? And both of them are harmless internal states, internal events, so that emotion is a harmless experience as well, of course. So this is very liberatory realization as well for patients when they are able to understand that with every emotion that they can feel in any moment, regardless the intensity or the frequency, they are just harmless internal experiences. It's a spatial combination of thoughts and physical sensations. And this is particularly important to transmit this message to patients. We also explain to patients that our mind can be divided in 2 main components. The first is the thinking mind, that is the part of the mind that creates all kinds of thoughts, so images, memories, judgments, interpretations, every kind of cognitions. And it can be seen, we use the metaphor, this metaphor in which, for example, we can see the thoughts as it is a conveyor belt, and the thoughts passing by in the conveyor belt very slowly, and we can just observe this passage in front of you. Another helpful metaphor is the metaphor of the leaves. So we can see the thoughts as leaves that passing by in the flow of a stream. And we also use this metaphor in the observing mind meditation, which is an important meditation in the 6th session. These are important metaphors to understand that the impermanence of thoughts, and that we can just be the observer of the thoughts, not the victims of the thoughts. In fact, we have another important component in the mind, the observing mind, which is the part of the mind which is able to observe a part of the thoughts that the thinking mind creates, and that it's also able to record a part of them. Okay, why it is important to understand for patients? Because through mindfulness training, of course, we train the observing mind, and we develop and cultivate the observing mind. And in this way, when we are able to increase the power of observing mind, we decrease the power of the thinking mind, which is responsible of course, all the OCD problems. Not only OCD, of course, but in OCD, the problem is that the patients are totally involved and totally dominated by the thinking mind. But when we are able to observe the thoughts from distance, using the observing mind, you are able to stay in touch with every kind of thoughts, regardless the intensity, regardless the contents, and just let them go. Okay, as we do in the observing mind meditation. I think that we don't have the time, unfortunately, to share this meditation, because it takes at least 20 minutes. But if we will have the chance to have a longer training, maybe I will be glad to share with you this important practice. Let me show you something about the evidence. We have now some important evidence about the effectiveness of mindfulness, but also about MBCT for OCD. This is just a brief review of the articles published on this topic. In particular, with respect to the MBCT for OCD model, we have a pilot study, which is an open trial that my research group published in 2019, in which we observed that at the end of the treatment, in the post-treatment, let me show you with the laser. At the post-treatment, we observed a significant decrease of OCD symptoms measured with by white box, and a significant increase in mindfulness skills. So there is an interesting correlation between these two effects. We also observed that a significant decrease in depressive symptoms correlated with an increase in mindfulness skills. And also a decrease in the general severity index in the SCL-19. So in the general psychopathology symptoms, we have the same trend of OCD and OCD symptoms and depressive symptoms. So this is very, very interesting preliminary data that we had with a pilot study. But the most important study we have now is a randomized controlled trial with 6 months follow-up that we carried out with the researchers from the Shanghai Jiao Tong University, in which we implemented a study with 120 OCD patients, Chinese OCD patients, and we have a control group of patients treated with medication. And what we observe is that we had a significant improvement in obsessive symptoms, both in the MBCT group and in medication group. And both groups maintain the outcome at follow-up, 6 months follow-up. But we also noted an interesting, significant decrease in depressive symptoms, both in the MBCT group and in medication group, and a significant decrease in anxiety symptoms, both in both groups. And in MBCT groups, there is a significant increase in mindfulness skills, also in the medication, but is not in insignificant way. Okay, so this is a really encouraging outcomes, but we need more research, and I'm absolutely interested in collaborating with research centers, universities, any kind of institution that are interested in projecting research, outcome research in this field. So these are some pictures taken from a real MBCT for OCD groups. And this is the manual with the seventh versions, which is translated. It is published by Guilford Press in 2020 and translated now in 6 languages. We have now the Italian version, the Russian version, the Chinese version, Spanish version, German version. Also thanks to Alexandra, who is the editor of this version. And we also have, we will have the French version, I think, in September or at the end of this year. So if you want more, if you need more information about the program, we can go to this link, www.mbctforocd.com. This is my email address. And this is the MBCT for OCD Center where I am now, and where we provide the program in individual and group settings, also in English and Spanish, and also, of course, online. So if you are still skeptical about the possibility to help patients affected by OCD to relieve from their problems through mindfulness, I can demonstrate that everybody can learn to meditate. Everybody. Okay, are you convinced now? Probably not. Okay, but I try. So thank you very much for your mindful attention. So this is my presentation. We have 15 minutes for final questions and comments, everything. Okay.
Well, thank you so much, Fabrizio. Really, what an amazing accomplishment, and how delightful. You know, I'll just comment briefly here that, you know, so many of us, I imagine, everyone in the room here with us has had transformational experiences through mindfulness and meditation. And I know myself, I began many years ago thinking, now how could this, what I've experienced in meditation, how can I apply that in my mental health work with people? You know, I mean, it's just kind of a fundamental question, you know, how can we put these two together? And you've done it, you know. It's just beautiful to see that you've taken these Buddhist concepts and practices and you've applied them so powerfully. And now you're validating it with research. Amazing, amazing, really. And so what a gift to the world. So what a testimony to the power of these practices, which are, you know, we all, again, we know are so powerful, but how do we apply them? You know, where do we actually get them to touch people and change people? So amazing. Why don't I go to some of the questions? We have some really interesting ones. If you've got a little more energy in your battery, you've given so much to us today, but if you can answer a few more, that would be amazing. And oh, I know you were interested earlier just to kind of hear where people are from. Just to kind of a quick scan through people's responses. We have mostly people in the US, but we have folks in Great Britain. We have at least one person in India, and I'm probably missing some others. But so we're pretty well scattered around the globe. Okay, so in no particular order, here's one. I wonder if you would please kindly describe what mindful exposure looks like in practice. For example, with an example, excuse me, with an example. So mindful exposure in practice.
Yeah, of course. Yes. Mindful exposure is help people to enter into a challenging situation, anxiety-evoking situation in a mindful state. So the first step in mindful exposure is to practice a mindfulness exercise that can help patients to enter in this mode of mind. And after the exercise, patients expose themselves to the challenging stimuli, using immediately using all the skills that they learn from the program. Because remember, mindful exposure is introduced in the 8th session of the program, so they are already skilled. And when they enter in touch with the anxiety stimuli, for example, touching a wash basin that can be contaminated, okay? So they are in a mindful state, they start to touch the washing basin, and they start to pay attention to exactly what their senses are saying to them, okay? Validating the communication from the senses, noticing the thoughts that can come up, and observing them from a distance, using the centering, using this identification, using special sentences from the program that can be helpful, using the 3I, you know, remember the thoughts as just inconsistent, just innocuous and impermanent, okay? And they cultivate acceptance toward everything arise in them. So if the anxiety activates, they understand what anxiety is, and they just stay in touch with anxiety, but realizing what anxiety is, just a combination of thoughts and the physical sensations, you know. So they use metaphors that has been helpful for them during the exercises, and so they integrate all the abilities they learn from the program in that moment. In that way, normally anxiety do not increase so much because they are able to see that stimulus in a real way. So the way in which every other persons would experience that stimulus. Okay, and when they noted that anxiety is decreased at the lower level, they can stop to expose to the anxiety stimulus, and they can end the mindful exposure with another mindfulness exercise in order to stabilize their mind, their body. Okay, so this is the process, basically the process of mindful exposure.
Okay, thank you so much. So I'm hearing there's mindfulness, exposure, mindfulness. So you're kind of wrapping the exposure with the mindfulness on both ends. And that's in actual, like you were saying, a wash basin someone might touch. So people are instructed to kind of bring in something that they fear. Is that right? And so two questions. They're invited to bring something in, or maybe you provide it. And then could it also be a thought? Could the exposure be simply like a thought or a memory?
Yes, yes. In fact, it is not only mindfulness in itself, but is using all the abilities they learned during the previous sessions, as I told you, acceptance, the centering. So when they expose to the stimuli, they are able to understand that this is just a thought. This is not a reality. Okay, so the washing basin is not contaminated because my senses clearly is communicating to me that it is clean. Okay, and I can realize that very clearly if I use the senses, if I validate the senses, if I recognize the thought as a thought and not reality. So there are several things that the patient realize when they enter in touch with this stimuli in this way.
Right. Okay. Now, you've also mentioned, just to follow up a little more, you've mentioned that OCD, I thought that was fascinating. You're framing it early in the presentation as a trust-based disorder. So it seems to me that in this example of, say, touching a wash basin, there is still something that can't be fully validated. Germs are not visible, right? And so they have to trust to a degree that it's clean, even though there could be influenza germs on there or something, right? So there is an element of trust as well. Is that right?
Yes, yes. Of course, we don't have enough time to explain in details all the specific elements of the exposure, but you are right. So people need to trust that the washing basin is enough clean.
Enough clean.
Yeah, enough. It's not totally clean, of course, but is enough clean that normally most people can enter in touch with that washing basin. So yes, the component of trust is important. You can have the control of everything, of course. You don't have control to everything, but you have to trust that you can enter in touch with the most experiences inside of you and outside of you in the way in which most people do.
Thank you. Yeah, the kind of the good enough experience.
Yeah.
Okay, another question in the chat here is, what does validating a perception look like? Is it describing in words?
Validating means that um, what I'm seeing right now in this moment in this object is exactly what it is the reality, and it is different from what my mind say to me about this object, because this is the problem in OCD. The mind uh, often lie. No, we say in Italian, you Dag, you can understand me because you speak Italian. Uh, uh, we say in Italian, uh, la mente che mente.
Mm.
Okay, it is not. It's not translating in the same way in English, but minds that lie. We have the same word in Italian, so we often say that to patients, because we very often believe to this pathological liar that we have, that is our mind, and we don't believe to what their senses say to us continuously.
Mm.
So validating senses means believe to what you are seeing, to believe to what you are hearing, and stop to believe to everything your mind is saying to you, because very often is not connected to what your senses is saying to you.
Very good. Thank you. So it might involve a few words, right? I often think in cognitive therapy, someone is having a narrative that says, oh, if I do that thing, something bad is going to happen to me. But they may use other words, narratives, to say, that's probably not true. I can do that and I'll probably be okay. They're still using words. So it's believing the senses is what I'm hearing from you, and yet probably also a few words are in there.
Yeah, it's not only a problem of senses, of course, but senses, the validation of senses is just one element in this program. But in other cases, you have to understand the real nature of thoughts, for example, and you have to use the centering attitudes, these identification attitudes, in order to neutralize, for example, the magical thinking, as you mentioned before. So the problem of magical thinking is that you believe to the power of the thought. But if you are able to understand what a thought really is, you decrease the power that you give to thoughts, and you start to use the thoughts for what they um, um, for what they can give to you, because mind didn't evolve over 3 million years to damage humans. The mind evolved to help people, to help humans to adapt themselves to this world. So it's a real, an incredible paradox that only human beings have, that instead of using the thoughts and the mind for what mindfulness is useful, we are dominated by our mind and its products. This is a really incredible paradox. And we try through mindfulness to overcome this paradox.
Well, that's a beautiful, expansive statement about the human condition, the paradox of the mind being it's been said it's a wonderful tool, but it makes a terrible master. Um, so yeah, holding that paradox. Well, I'm determined to stop us on time. So Fabrizio, you can go and have dinner, I hope, and relax and
You
rest
have
those.
you have a lunch.
Yes, some of us will have lunch and um,
Oh, I just want to say a final thought. I think that uh, what is my aim now is to do more research in this field, of course, but also to train as many therapists as possible in this program. So I will be very glad to give training worldwide. I'm still giving training worldwide, but in particular in the United States. So also together with Doug and his institute, I will be very happy to give a more intensive training, a professional training in this field. So if there are anyone who is interested in training in this program, can contact Doug in order to understand if there is the possibility to organize a professional training. And
Agreed. Yes.
yeah.
Yeah, we would be very happy to hear from folks at the Institute. Of course, it's meditation and psychotherapy.org. You can reach out to us. And that would be my wish as well, that we could do more work with you, Fabrizio. This has really been just amazing and so inspiring and so well organized. So thank you really so much for your time. It's so generous of you. Great to have you all here with us, and hope we all come together again soon. So bye for now. Thank you. A
So
presto.
thank you very much for coming, and hope to see you all very soon. And thank you for inviting me. Bye.
Buona serata.
Ciao a tutti.